Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. In today's video, I'm going to share with you how to work on your scar tissue after surgery. Now, if you are suffering from any kind of pain around your scar area after surgery, it is very important that you need to mobilize your scar. Many times I've seen people who have undergone surgery are very much scared and are refraining to touch that scar area. Definitely, scar needs to be taken care when the scar or sutures are very fresh. You don't need to move them, but as your stitches are settled, if your stitches has been removed if required, then definitely your stitches and the area around that needs to be mobilized. Otherwise, they will become so taut and they will adhere to the deeper structures that it will not allow the area to function well and will become a source of pain in future. So if you who are someone who has gone through any sort of surgery, including cancer surgeries as well, and if you have got scar tissues, I'm going to show you a very simple and easy self-massage technique that you can do around your scar tissue so that the scar or as the suture area doesn't become adhered to the deeper structures and does not become the cause of pain. People who have undergone cancer surgeries, people who have got surgeries in general with or else around the area where the muscle mass or muscle bulk is less are more prone to develop these kind of scar tissues. And that's why mobilization of that is very important. So let's get started and have a look at how to mobilize a scar. By the way, I am physiotherapist Meghna Dave, founder of HealthQ Rehab, a neuro rehab physiotherapist, and I'm here to help you out with all your physical health related concerns. So make sure to subscribe to this channel and click the bell icon so that you can get notified every single time we upload a new video. Let's get started. So in order to explain you, I'm taking this example of the scar tissue in my hand. This is a burn mark, it's not a scar tissue, but usually what happens if you have gone through a surgery, you will have an area in your body which will have stitches, right? Now what happens if you don't mobilize the structures around the stitches can become tight because of lack of movement. Many a times areas in the body where the movements are in general less, where there is less muscle bulk below the skin area, are more likely to develop adhered scars. That's why it is important in such areas you should do mobilization of the skin and tissues around that suture area. So this spot I've chosen to show you just because this is an ideal spot. Many people might have a suture or else a scar tissue here. There is very less muscle bulk and fat tissue below this area, and this, even though is a mobile area, but still many patients don't move hands after their surgery just with the fear that the suture will break. Definitely you have to follow your doctor's advice in how early or how fast you are allowed to move, but once the suture or else the scar area is stabilized, there is no blood oozing out, then definitely you should start gentle mobilization of the area. Now in order to mobilize a scar, what you need to do, there are three simple steps you need to do. So first thing, this is the scar, so you need to first move the scar side to side, move the scar back and forth. Okay, so that's your first step. So how will you do? For example, this is your scar tissue. You need to first mobilize it. 1 2 3 4 5 6 7 8 9 and 10. Then you will do back and forth. 2 3 4 5 6 7 8 9 10. Then you will do circular massage. 2 3 4 5 6 7 8 9 and 10. Then anti-clockwise. 2 3 4, 5, 6, 7, 8, 9 and 10. So this was step number 1. Step number 2 is to mobilize the skin and the tissues around that, because what happens when your sutures are healing, right, they pull the skin and every structure towards the center. So this becomes pulled and become taut, and that's why they also require release. So you will do a circular massage like this: 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10, and then anti-clockwise: 2, 3, 4, 5, 6, 7, 8, 9 and 10. Then below: 2, 3, 4, 5, 6, 7, 8, 9, 10. Anti-clockwise: 2, 3, 4, 5, 6, 7, 8, 9, 10. This way: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Anti-clockwise: 2, 3, 4, 5, 6, 7, 8, 9, 10. Here: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Anti-clockwise: 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Below here: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Anti-clockwise: 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Now if your sutures are dried up, there is no freshness or no extra fluid or blood coming out, you can also apply ice pack in this area. What ice pack will do, it will reduce the spasms that happens around the structure. Don't apply hot fomentation if the sutures are very fresh, because that can increase the swelling, it can increase blood supply and can cause rupture of the sutures, right? So ice pack is better, not cold pack. Apart from that, what you can do is you can just drain some fluid. So let's say if we have lymph node, this is the hand, so this is the hand and here are your lymph nodes, right? So you need to drain the fluid. So you can do some drainage in this way, starting from your hand to your elbow to your shoulders in this way. So when you do this, what is happening, all that you released and the fluid that was accumulated will be drained towards your lymph nodes. So when you do that, what happens is you are also removing and draining the fluid back to the lymph node. So there is no fluid accumulation, there is new blood supply, so there is no scar formation. At the same time, the suture, that suture area, that scar area is mobilized. It is not getting adhered to the deeper structures, will not cause pain and will not cause discomfort. So it's a very important practice, but yes, definitely for these kind of practices, at least once you should take guidance from your physiotherapist as well as doctor. Ask to your doctor, your surgeon, when you are allowed to mobilize. Mostly in hospital stays, your doctor and physio tell you that, but after that it's your job to take care of your suture area. So make sure to take care of that and then start working towards your recovery process. It's very important. Along with that, if you add up breathing exercises, physical activity, as much, you don't need to walk around if you are not allowed to, right? But while lying down on the bed, all the joints, all the areas which are not involved because of the surgery, try to move them, because movement is the key. When you move better, the blood circulation stays better, lymphatic drainage stays better, there is no swelling that is formed. When there is no swelling, there is no pain, and you will have a faster and better recovery. So I hope you found this video helpful. If you have got any questions, any doubt related to your suture recovery or its post-surgical recovery, feel free to write to us. We would love to answer your questions. On that note, I'll end this video here and see you in another video. Thank you.